Kia ora koutou. Thank you all for coming, and I'd just like to take this opportunity to thank Debbie and Bale for asking us to be here this afternoon to present the findings of our research. The longitudinal study, the life histories of people with spinal cord injury, began in 2007 and ran through to 2011. What I'm going to do is, in this first part of the session, is I'm going to explain to you the study itself, and so when Sarah comes on, she is just going to talk about the experience in the unit. Then I will talk about the transition from the unit to home to whatever, and then Charlotte will talk about the socio-economic outcomes of spinal cord injury in New Zealand. I want to begin by acknowledging the participants and the research team and key people who have been involved in the study, who actually made this study happen. There's Dr. Zhong and Shrita Retresh from Burwood and Auckland, the clinical directors respectively. And Rick Ackland has also had some major input and help, and has even written one of the papers with us. Carla Cooper and Karen Marshall, who were the nurse researchers at Auckland and Burwood here. The core research team, Sarah, Charlotte, Peter Hubison and myself. And then there are our co-researchers, Carolyn Beaver, Paina Taman and Pam Ferguson. At this point, I'd just like to acknowledge Pam Ferguson. She passed away during the study, and we particularly were really saddened by that, because she was a great support person for the project at Auckland. Paina, who is from Burwood here, he had family commitments which necessitated his leaving the study reasonably early on. There's Maureen Crawford, who is our project manager. And then there's Bale, and Bale were of huge assistance to us, and particularly Julian Verkuyk, Tony Konofsky and Debbie Snell. And then there's Cask in Auckland, and Anita O'Connor and Anne Phillips were people we want to mention there. And as you know, to have a research project go, you've got to have money, and the Health Research Council were our main funder, but Bale also contributed funds as well. Okay, the study. The aims of the study, there were two aims to the study. The first was to examine the relationship between body, self and society, and how these impacted on people with spinal cord injury, and how these may have influenced life choices, life chances and subjectivity of those people. The second aim was to investigate how entitlement to rehabilitation and compensation affects socio-economic and health outcomes. That just does a comparison between those on ACC and those not on ACC. Okay, the methodology. It was a mixed method study involving qualitative and quantitative data. There was a baseline interview at 4 months, seeking quantitative data on demographic factors. At 12 and 24 months, there were telephone surveys where these sought quantitative data on health, family, life, work, psychosocial wellbeing, etc. And then there's another part of the study where we did in-depth face-to-face interviews at 6 and 18 months post-discharge. And these collected qualitative data on meanings and interpretations placed on living with spinal cord impairment. Eligibility criteria for the study was this had to be your first admission to a spinal unit in New Zealand. You had to have neurological damage to the spinal cord. You had to be aged between 16 and 65, be willing and able to complete a 45-minute interview, and be a New Zealand citizen or resident who was fluent in English. How we recruited people was we recruited them during the rehabilitation phase, and nurse researchers would approach people who were new to the spinal unit and ask them if they wanted to be part of the study, and if they answered in the affirmative, we would then send along our representative who was a wheelchair user at each of the sites. So here it was Painter to begin with, and then Carolyn Beaver took over, and in Auckland it was Pam Ferguson. The incidence of spinal cord injury. Recruitment between 2007 and 2009, so the first 2 years of the study we were recruiting people. 186 people aged between 16 and 64 entered one of New Zealand's 2 spinal units during that period. 162 were eligible for participation in the study. 15 declined. 26 were non-contactable. So 118 people participated in the first interview, which was 73% of all those eligible. In the second interview, 103% participated, which was 87% of those who took part. And in the 24-month interview, 91 people participated, which was 77%. Now we're getting on to the presentations. Are there any questions of clarification about the study? Fine. Okay, we're going to have, as I mentioned before, Associate Professor Sarah Derrett will talk about the Burwood Spinal Unit experience now, and then I will talk about transition, and then Professor Charlotte Paul will talk about outcomes following the spinal cord injury.
Thanks. Hi everyone, it's great to be here today. I'm able to share some results from the study with you. This next session I'm going to be talking about people's experiences here in the spinal unit at Burwood. We've obviously also collected feedback from people about their experiences in Auckland, but I'm very much focusing on the Burwood experiences today. The positives and some of the not so positives where there could perhaps be, things to think about in practice. So, firstly, Martin's touched on some of the characteristics of participants in the study, so I'm not going to go over those. There's been a publication in 2010 that sort of describes the study in some detail, so if you were interested, you'd be able to find that reference or contact us and we'd be able to send it to you. Martin's already touched on when we recruited, there were 164 eligible, I had 118 participated, and I'm going to focus today on the 59% who were recruited to the study from Burwood. And this paper at the bottom describes some other characteristics of participants in the study that I'm not going to include in this publication, but again, if you wanted that paper, just email us and we'll send it through to you. So firstly, in the quantitative part of the study, so Martin mentioned that people were all interviewed at the 4-month mark by one of our interviewers. There was a question that asked, overall, how would you rate your experience with the service provided by the Burwood Spinal Unit? And it was resoundingly positive. 64% gave the highest possible rating of very good, 24% said it was good, and only 12% said it was moderate. And as you can see from the scale, moderate was in the middle of the range. There were no participants from Burwood who said the experience was bad or very bad. And although I'm not including Auckland's data in this slide, they also had no participants say it was bad or very bad. And there were no statistical differences in overall satisfaction with the rating of the service provided between the patients who were admitted to Burwood and the patients in Auckland. So I'm going to touch on the positives about being at Burwood, and these images that I've just downloaded from the internet about Burwood sort of are the key to where the positives were really, in terms of largely around the people and the care that staff here provided to participants in the study. However, there are also things about the unit itself. So one of the positives was you got a sense of mission about the unit, not how to mollycoddle you, but to make us learn how to look after ourselves. And also people mentioned the transitional rehab unit, and in particular advice from other patients who had been living with the SCI and receiving encouragement from them. So it was both about the staff and professionals here at Burwood, but also their peers and the role that they played. And the environment, I mean, we were just walking through to the cafeteria before and commenting on how beautiful it is here. And this is what people were telling us in the study. It's just great. It was like going into a 5-star hotel after being in Christchurch Public. Yeah, it was really great. Our rooms opened onto an area like that out there and flower gardens, and it was just, we each all had ranch sliders and that opened out there. The meals weren't that great, but never mind. Yeah, the treatment and the care that you get at Burwood is very, very good. And in terms of the unit itself and the teams, again, people were very, very complimentary. All the doctors, everyone there had only one objective, right from the tea lady to the consultants. Their only objective was to get you as well as you could and get you right and get you out of there, sort of thing. But it wasn't, I wouldn't really like to single anyone out for a special mention. They were all good. My welfare and well-being was their only concern, basically. It sounds silly, but I almost feel privileged that I've been through Burwood, which is a pretty compelling sort of acknowledgement of praise for the staff and the environment here. And participants also commented on feeling very strongly that their families were also well supported and cared for by the staff and professionals at Burwood, and that was very, very important to them as well. So on to the professionals. Out to Burwood, and basically from day one we were treated very, very well at Burwood. You know, the staff and doctors, and of course we all made a bit of a mate of Dr. X. He was just fantastic. He was a can-do doctor who probably had to fight his own battles in amongst the bureaucracy, and he was fantastic, wasn't he? And that sort of participant was talking to their wife at the time when they made that comment. And very much. The physio people were good, the physio and the OTs were great. They were really very good because they've got a defined process in science. Physio is physio and OT is OT, and the medical side of it is a little bit different and it's not a known thing. So sort of really acknowledging the different specialties of the professionals involved in different aspects of their care. And the nurses got a big mention too. So we had primary nurses, which I thought was a very good idea, because if you had someone you could refer to if there was something special happening in your life, or we needed particular help. And then this other comment is in relation to the primary nurse who really made that participant really aware of the drugs they were taking, so that when they left Burwood, they'd go home and know exactly what medications they should be using and when and why they were using those medications. And there were also a lot of comments made in relation to the nurses and the importance of having a primary care nurse involved with them in terms of the emotional support that they got, and getting to know that individual nurse well enough, and having the support and encouragement from those nurses to deal with the emotional and psychological side of things. So they sort of acknowledged how, sometimes people were angry or very, distressed and upset, and those close relationships with the teams of nurses were key. But it wasn't just the nurses, the doctors, the OTs and physios. Nurse aides also were mentioned, social workers were mentioned. And this quote here, I've just got really, I can remember we had an excellent social worker, but I remember them saying to us, I've spoken, tried to get hold of your ACC case manager in this case, finally been able to get hold of her, and I don't think it's going to be an easy ride for you guys. She said some of them are better than others. So really, I've just included this quote to remind me to tell you that I'm really just talking about the experience in Burwood. There's a whole range of experiences, as you know, that people have when they leave the unit, and they're perhaps engaging more actively with ACC if they're covered by ACC. And Martin's going to come and talk about some of those issues in the transition home, and Charlotte's going to wrap up the day sort of looking at the different outcomes, or our session, sorry, looking at the different outcomes for those who were covered by ACC and those not. So, and psychologists were mentioned. I'm not sure if there's any psychologists in the audience, but people were very grateful for psychological support they had here as well. But also non-professionals were very, very highly commended by participants in the study. So the best people in those units were the guys, the independent living coaches, that's what they call them. And there was a sense even from some participants that it would be great to see those independent living coaches in more sort of leadership roles within Burwood. They thought they were just extremely experienced and related really, really well to participants in our study. So what about not so positive? So if everything's great, it's sort of hard to improve. So we've included some quotes from some of the experiences where participants thought things could have perhaps been a little bit better. I'm sure you'll be aware of many of these anyway. In terms of communication, people felt that the doctors and nurses acted as a team, which is great, and they had a team meeting every Thursday in which your progress was discussed. But there was a sense that I discovered that they had this team meeting every Thursday and patients were discussed, but nothing was ever said back to the patient. And they were making decisions for me that I didn't necessarily want, and I felt very angry about that. So there was a sense there could be improved communication between the multidisciplinary clinical team back to participants. And a similar comment, doctors had one issue, and they're really talking about the sort of speed of communication at the bedside here really. Doctors had one issue that they would discuss, this one issue, and then they'd run it for practically, and you had to say, hey, hang on, I want to ask about this or that. And it was quite difficult getting them to come back to your bed. It was the typical story of being surrounded by all of these faces, discussing about you, not with you. Yes, I had to think beforehand, so before the team round, what I want to know this time, and I'd try really, really hard to catch them at it. So this experience of lying in a bed and having a team arrive, discussing their situation, but not feeling they had enough time to engage actively in that process and ask the questions that they wanted answers to. Access to doctors was one of the not so positives raised. It was very hard to get a discussion with a doctor. Like if you felt pain or whatever and you wanted to discuss something, you couldn't get hold of anybody. And what they would say would be ward round finishes at 1:30 p.m, be outside the last ward and grab a doctor as he comes out, and your consultation basically lasted as long as you walked along the corridor, and that was it. So there was no medical type doctor that you could just have a talk to or explain how you were feeling or what you think needed to be done or whatever. So on the positive side, there were lots of comments about really positive opportunities to engage with nurses about that, but clearly, participants in the study really valued the input from doctors and felt they didn't have enough time for that. Inconsistent staff was an issue for some. Yeah, I mean, having different nurses every day, that, you're always rushed, I suppose It's not always the nurse's fault because they're so sometimes understaffed and rushed, you know, but you really can't even call it care, you know. What I mean is you're just on a factory line almost, you know what I mean? So feeling if the staff weren't consistent. So we've heard already the positives about having a primary care nurse who's sort of involved closely in your care. When that didn't happen, people felt it wasn't such a positive experience. And also with weekend cover, the only downside, and that's not anybody's fault apart from the government's, is that in Burwood, because it's obviously a spinal unit and it's a fairly specialised sort of setup, that there are a lot of agency nurses coming in, and so especially at the weekend, so they really don't know what they're doing. They were starting to catch up on it by the end of the day, but then you didn't see them again, and that was really annoying. And sort of some concern about even sort of things that are quite sort of fundamental to participants, such as sort of, you know, relieving pressure areas and things. They felt that some of the agency staff who would come in, obviously out of, you know, need because staff were sick or on annual leave, weren't able to respond to their needs. And I think really people just felt they needed more. So I didn't really enjoy the physio, I think, because my level of break, there was not a lot they could do. So they didn't really, you know, they tended to focus on paras more than they do on tetras, I believe. I spoke to other tetraplegics and they felt the same, you know, like, but it was just limited. They seemed to really focus more on the paraplegics, I found. Well, this quote, I was really impressed with the physios. They're all very dedicated. They're a very hard-working group, and I was very impressed with them, very professional. And yeah, one note, so it was on a Friday, 4 p.m. on a Friday, and we finished the afternoon session, and okay, I'll see you on Monday. And I said, like, what do you mean you'll see me on Monday? I said, my body doesn't stop at 4 p.m. on a Friday. Which was, the physio though explained to the person that it was actually an important part of the process to have some rest periods along the way, and that having a weekend off wasn't necessarily a bad thing. So the systems and teams, participants are really acutely aware of team relationships and dynamics among staff. I guess, you know, they're lying there or sitting there observing people, and they were acute observers of teams. So I never got the impression that the doctors, OTs and physios and nurses worked as a team. Physios wanted everyone to be at the gym at 10 a.m, but no way the nurses could meet that deadline. They were talking about needing bowel cares and all sorts of things beforehand. That upset the physios, but they, the physios, never came to give them, the nurses, a hand. So that was a sort of sense of, you know, one participant. To be honest, the OTs thought they were the most important ones, and so did the physios. And the nurses tried to keep them all happy. You great nurses. The nurses tried to keep them all happy, but to me the nurses were the most important ones. And the physios and the OTs should be working in with them, not the other way around. So just in terms of summary of the things least helpful, so when there was a sense that things were disorganised, or there was poor time management, and in particular the sort of team coordination, so requirements to be at certain appointments, but certain things had to be done first, and the pressure that put on everyone to make that happen. If it didn't feel coordinated, that was a problem. Very rigid timetables. There was quite a bit of discussion about perhaps too much focus on the physical and not quite enough on the psychological. When equipment wasn't right for participants perceived fit for purpose, and distance from family was an issue for some. And then just to summarise the things that were most helpful, the staff, the doctors, nurses, physiotherapists, occupational therapists, counsellors, life coaches, other patients and family. And when staff worked as a team, it was really, really appreciated. And people also reported really sort of enjoying that encouragement to take responsibility for their own rehabilitation. So in conclusion, there was no overall satisfaction difference between Burwood and Auckland, as I mentioned earlier before. Relationships between staff and effective coordination is key, but a clear and consistent message was the opportunities for improved communication between the health professional team and patients wherever possible. All staff and teams are crucial, and the overwhelming thing was that just the degree of positive feedback to everyone at Burwood. So just remember that 88% of participants gave it very 2 highest ratings out of the possible 5. only 12% said, you know, it was overall moderate, and no one said it was bad or very bad. So I think it was excellent feedback, and thank you very much. I'm going to hand over to Martin now, who's going to talk about the phase following the time in Burwood to return home.
Okay, so I'm going to talk about transition, and I'll read off my notes. So if I drop them on the floor, don't worry, that's deliberate. Okay, I'm just going to hurry through that. Transition, in a sense, transition begins from the day you enter the spinal unit. Now that's a truism, and I'm not going to follow up on that much. But then the real pointy end of transition happens when people are about to go home. Are the services in place? Is the accommodation sorted? Have housing modifications been completed? And then once you're home, there's a kind of the psychosocial dimension of transition, where you're trying to figure out your role in the family now. You're trying to the family is also in transmission because it's got transition, because it's got to accommodate you. And then finally, thinking about returning to paid work, finding paid work. And all the time, you are learning to live a spinal cord impaired body. And that never stops. And you're always in a case of transition. So the 12 and 24 month interview, we kind of found that the ACC people seemed to be getting the care hours they needed, while the Ministry of Health people were in a bit more of a battle for the hours they needed. And I should just say that this data here is global data from the whole study. And so it's not always, this isn't specific to Burwood. Okay, as Sarah's just mentioned, physio and gym always stopped a bit earlier than people thought. They said they would have liked more. What's happening? Okay. 82% of the respondents said that they really felt they'd had their needs met by physio. So what's that, 18% didn't feel that their needs were completely met. O2, occupational therapy, high numbers of people thinking their needs, deciding their needs were met. Home help, the figure in home help, which I think is really interesting, is that 30% of people in the 12-month interview said that they've had an unsatisfactory assessment process. But 93% said it was easy to get, and 75% said all their needs were met, even though the assessment process wasn't that great for 30%. Personal care, most people were getting the personal care they needed, they were getting reliable carers, and they were getting competent carers. People who were looking for equipment, high percentages got the equipment they needed. Reasonably high percentages of people got their needs met by wheelchair services. 78 and 89% of people got their needs met by the counselling, so the counselling seemed to be working. Weren't very high numbers seeking counselling. and 84% at 12 months and 98% at 24 months were getting all their medical consumables. Yes?
Martin, is this combination of ACC and Ministry of Health?
Yeah, this is combined, yeah. Yeah, so everyone's getting their supplies, and their services seem to be in place. So that's definitely assisting transition. Services, some quotes were taken from the 24-month interview, and these are quotes from Burwood people. Okay, it's really useful mentally and physically. Services, good quality, but not enough visits or hours allowed. Monthly appointments are pointless. Not doing ongoing due to costs. So that person must have been, we could assume was an MOH person as opposed to an ACC, but that could also be drawing a long bow. Other people said, another person said it was very good, and that person was being funded by ACC. Now I've just included two quotes about the occupational therapies because they are kind of poles apart. OT suggestions not taken up by the employer, but OT was brilliant. Then again, she was very mean-spirited, all about cost-cutting and minimal input. You know, so two sides of the same coin. And I've just said that I reckon that ACC and the Ministry of Health, they're the oil which is in the machinery of transition. Because if you don't have ACC on your side or Ministry of Health on your side, it's just that much more difficult to get things done. Okay, so at 24 months, these were people that got towards, you'd say they would have got all the pointy bits of ACC done, and this is what some of the comments were. Good case manager, battled to get ACC, but once on ACC gave all the support I needed. Then another person says, case manager, useless, unreasonable, would ring him and he did not do things. Then another person, have not been denied anything I've asked for. And then another person, yeah, but I've had to fight for everything I've got. You know, one participant, they were really fast and efficient ACC. Then contrasted with anything I've asked for has been granted, but time taken too. And process things often too long, and efficiency of the system not great. So really what we're just saying, there's a whole spectrum of responses from ACC and experiences with ACC. Okay, if ACC get it in the gun at times, what about the Ministry of Health? Now remember our numbers were rather small in the Ministry of Health. They were, this is just 16 participants who responded to this question. And one person says, we've had to have persistence with them. In other words, you've got to keep on knocking on the Ministry of Health door. Service is good, always help me out, okay? Help so minimal that you end up doing things yourself. And I suspect that's true in most cases. And this person says, has done well out of Ministry of Health, have not really questioned the OTs. So the OTs have made recommendation and the ministry's provided. Okay, then the big question for transition is your house, your accommodation. And here's some quotations which from people reflecting on getting their housing alterations done. Frustration with delays in planning, and getting the plans drawn up and getting started. And at the time we did our study, they had, just before I go on that, we know that things have changed considerably since we did this collection of data. We've had earthquakes, ACC has changed its contractors and changed some of its processes. But I think that you can change people you contract with But if the culture doesn't change, it doesn't matter who's doing it. So I'm thinking that these quotes give us an idea into the culture as it was at ACC and the Ministry of Health at the time, and it's up to you to say what the culture at ACC and the Ministry of Health is now for getting home alterations and things done. So at the time there were these things called preferred builders, and one person said they were a real rort and they were open for, and it was open for abuse. Individual requirements weren't listened to. There was a couple of ex-builders who were paras and teachers who had huge knowledge in the area, but they just weren't listened to. They were treated as idiots. Unhelpful bureaucratic procedures in which we know best attitude prevails. There's a lot of wastage and expensive choices. Like one person was arguing that a little wee ramp would have done to get up a little step. And ACC insisted on putting in a lift, you know, and that was an expensive decision. There was a bottleneck with one firm, Opus at the time, they only had one firm, but now I hope ACC's got at least half a dozen firms doing alterations for them. Temporary accommodation was a real pain in the butt. Motels, carports and bedrooms are far from perfect. Halfway houses at best are depressing and frustrating. There was expressed to us, particularly in our qualitative interviews, there was a lot of frustration around all the processes for housing modifications. A couple of quotes here on transition and one person who was in a halfway house. On transition, but it was nice. Those units are great. Nice to spend some time in, like, let's say, half a normal environment. It's not easy, half a normal environment. They're a little bit kind of run down. They need some funding, and I know it's all voluntary again, but I mean they are a brilliant idea. And then this person who was in a halfway house. Well, pretty much they, on a Wednesday, come and said to me, your discharge is due on Monday and we're going to send you to X. I'd heard some horror stories about X, so I said, no, I don't really want to go there. So they then said to me, well, you'll have to find somewhere else. So we ended up running around all over town, trying to find a rest home that could take me. So we organised going to Y, which ACC said would be for 2 to 3 months. 8 months later I said to ACC, look, you've got to get me out of this place. This is like a hospice. There are all these old people lying around waiting to die. I thought the only way you were going to get me out of this place is in a body bag. Now that's not a good place to go to, is it? Here's some other comments about shifting and housing modifications. They, ACC, said the renovations would be finished by the time I left the spinal unit. That was a joke. Opus was doing the plans for the house at the time before we came home. He sent the plans to us down there and I said, that's no good. We drew him up a rough plan, but he threw them out. And we find out now it would be far cheaper to do what we planned and more convenient, but he didn't want that. So that's right. It was awful. Being under the Ministry of Health was part of the problem, is I have to go through the social worker to try to get anything to happen at all. Trying to arrange things with WINS was hopeless. We had a house that was not livable. It was really hard for my wife because she had to see a place and then she'd say to me, oh, you must come and see this place. I'd come and see it and I couldn't get into the bathroom, let alone the house. And under the Ministry of Health, that's much more important. Your access to the house, because you know they don't supply an awful lot. So it was not a very good experience. Okay, so you finally get home. At 12 months, we asked participants, okay, so how are things going at home? These are some of the responses. Great. Some frustration that feeling's not contributing as much as was the norm. Biggest frustration, days when you don't have as much huff and puff. Don't feel as if I'm pulling weight as much as I would like to. Another quote. When they get the house finished, it will be so much easier. I can't wait for my kitchen to be done. It's just very frustrating for me. So, okay, so I think, you know, kind of like sending people home to an unfinished house, that really says to you what a bummer spinal cord injury is, and not having full movement and not having accessibility. Not having accessibility just disables me. And so I think the spinal unit should think very carefully about where and when they send patients to. A number of people referred to their wives. Good, very supportive wives. Wives weren't the only ones who were the great support, husbands were as well. Being looked after really well. Husband at home most of the time. So, reading through all the responses to this question, it became really quite clear to me that if you were part of a family, if you had a supportive partner, it made the transition process so much easier. And the final quote there, it's all good to go out with friends, get to the gym. Mum probably helps out more than what she is paid for by ACC. And all carers do that. All natural carers do far more work than what they're paid for. Okay, so what are some of the downsides at 12 months? Very quiet, home on own, don't go out very much, don't want to go out much either. Then this person says, not too good, and then ominously, do not want to elaborate. So you're just left wondering what's going on there. Then this person, it's a struggle, I'm lonely, difficult to find a partner when you've got a handicap. My kids have found it hard. Biggest impact on youngest, but do not see him. Any break in routine can easily cause me to slip backwards. For example, not going to the gym one day will lead to making excuses as to why cannot go the next day and so on. But I just wanted to end this section on a bright note. Things are going pretty well on the whole. Relationship with X has blossomed. Okay, so how were things at home at the 24-month interview? Overwhelmingly, by this time, the responses were positive, and here are some of them. With the new house, things are falling into place, going well. Good. Husband living with her now because of the mods being done to the house. You can already see that having somewhere accessible to live in makes a huge difference psychologically and physically as well too. Very well, I can do more. It's excellent. All right, as per normal. Going good in most areas, frustrating not being able to get myself out and about. On the whole, managing at home can help with cooking, washing, which is good. And then at the bottom, not so hot, things are not great. Now, there's still room for improvement for some people at home. Would like to improve sexually. Would like better emotional connection with my wife. I do find you can get quite close to carers due to the amount of time you spend in their company. Now, I'd say that's really dangerous. And I think that's an issue which needs to be dealt with in the smaller unit. Still feel bad after 2 years. I don't feel normal. And then still a lot of psychological healing to do and healing for my family. I feel there is not enough support for the families because they live with the disability too. Social and romantic aspects of life are not back on track, and I often cannot go out because I cannot afford to. In the qualitative interviews, a number of people did say to us that they felt as if support for families was sadly lacking once they got home, and also when they were in the unit. But I thought we'd better continue the ongoing story, and I thought what happened to that relationship was blossoming, and here's what happened. X is the best husband, nurse, friend that he ever was. Carers are fabulous. So that's one happy story there, really happy. But the ho-hum, the reality of living at home with spinal cord injury, have good days and bad days, overall all right. And that's all our stories, eh? We all have good days, we all have bad days, and overall it's okay. Average overall can be strained between me and husband, not able to do what they used to do, and less spontaneous. Husband finds it difficult with her asking for help all the time, and he would prefer to have some home help as well. And I think reading between the lines of that, it gets us back to sex. And I'll just say that just one of the quantitative and the quantitative figures around sex was when we asked people if they had decreased sexual activity, 34% said no, 65% said yes, and the number of participants responding there were 91. So 65% with decreased sexual activity is quite a big number. These are some of the quotes. It hammered the hell out of our marriage. Washes over everything, it really has. My wife and I are working on it. It has impacted hellishly on what you used to do before. You can't do that sort of thing anymore. We talk a little bit, not as much as I'd sort of like to. I know that because I can't function like I used to, it has impacted on her emotionally in a big way. I thought I was only half a man, and that's huge. Now, the next quote is really perceptive. This is the wife of the spinal cord injured man, and this is what his injury's done to her sexually. I've been struggling with feeling old and feeling very undesirable. And I miss N's advances in desiring me, and I mean that's part of marriage that I enjoy, even just as much as what went on after that, you know? I enjoyed that whole knowing that I was attractive and I was the one in his eye. And I know I am still, but I don't get the proof of it. You know, so if you can't do it one way, can have huge impact on how your partner feels about you and herself. And then this last one, I hated it. This was incontinent.